Hello guys, so good day. So we are on the second part and last part of our topic on electrolytes. So we will discuss today magnesium, calcium, your phosphates, bicarbonate, and an ion gap. Yan. So marami yung topic natin today. So let's begin with magnesium class. So your magnesium class is a cation. It's positively charged, diba? So 2 plus ang magnesium natin. So, it is second in amount next to potassium. Yan, nandito sa slide natin. So, up next to potassium, ang isa sa pinakamaraming positively charged particles ay magnesium. It is the fourth most abundant cation in the body. So, next to sodium, chloride, potassium. So, ang fourth honor natin is magnesium. And magnesium actually antagonizes calcium. Yan. So, once there is excess magnesium, yan, it prevents the function of your calcium. So, class, most of your magnesium is in the bone. Just like your calcium and your phosphate, 46% is in the muscles and the tissues, and 1% is in the circulation or in your serum and inside your red blood cells, class. So, konti lang class yung nasa circulation na magnesium at yun yung minemeasure natin in the laboratory. So, magnesium is very important in the structures of your genetic materials, yung DNA, RNA, and ribosomes. So, it allows the movement of potassium in your myocardium. It acts as your coenzyme, right? And class, it regulates your ATPase and ion pumps. So class, this pumps facilitates the exchange of your different electrolytes. So magnesium is part of these pumps. And it is important in neuromuscular excitability or in the contraction of your muscles. Again. So, for your magnesium, so we have 3 forms, guys. We have free magnesium. So this one is the one that we usually measure. We have complex magnesium. So complex magnesium are attached to different anions and protein bound. So usually the protein is albumin. Yan. So class, what regulates your magnesium? So we have 3 hormones. So first one is your parathyroid hormone. Class, huwag kayong malilito. Parathyroid hormone, it's the major electrolyte that it regulates is calcium. Yan, the major electrolyte that parathyroid hormone regulates is calcium. But it also impacts your magnesium. Pero pag parathyroid hormone, ang nasa isip nyo is calcium, ha? But nevertheless, class, your parathyroid hormone increases the magnesium in your circulation by how? By absorbing tubular absorption of magnesium. So instead of releasing magnesium in the urine, class, it reabsorbs it. Yan, ginukuha niya, it retains magnesium in the kidneys and increase the absorption in your intestine. Yan. So from the diet, class, you are able to intake food that are rich in magnesium. So as it passes to your intestine, it will be absorbed. Yan. So yung parathyroid hormone yan. So it increases your magnesium. And class, aldosterone. So aldosterone and thyroxine. So aldosterone. So it's from your adrenal cortex and your thyroxine. So it increases the renal excretion. So sila ang nagpapa-release, nagpapababa ng magnesium to your they throw out or they excrete magnesium into your urine. So class, if your magnesium exceeds 0.6 to 0.85 millimoles per liter, yan, it needs the magnesium will be released in your urine. So yan yung limit niya. So this is about 4 milliequivalent per liter or 4 milligrams per liter, 4 milligrams per DL, if I'm not milliequivalents per liter na lang tayo. Milliequivalents per liter. So if it will max out for milliequivalents per liter, it needs to be thrown out to your urine. So class, ano ba ang renal threshold? So this is the limit wherein your kidney can withhold or can retain a particular substance. Example, class, if you remember in your glucose, the maximum threshold of your kidney for your glucose is about 160 to 180 milligrams per DL. So class, sa circulation natin, so kung pasado ng mataas ang blood sugar ng isang tao, it exceeded beyond 180 milligrams per DL, glucose will now be present in your urine. Yan. So class, kung 120 milligrams per DL pa lang yung glucose sa circulation nyo, yung glucose levels nyo, yan, 150 milligrams per DL, hindi pa lalabas ang glucose sa ihi mo. But beyond 180 class, yan, lalanggamin na ang ihi kasi glucose is already present in your urine. So same thing with magnesium, we have a threshold. So class, FYI, so this is your thyroid gland, and I want to show you that we have 4 parathyroid glands. Yan. So class, I think alam niyo naman na that natanggal na yung right thyroid gland. So when I broke up with my boyfriend, I decided to have my thyroid. Kasi may goiter ako, class. Basta pag-break sa akin yung jowa ko, sabi ko, alagaan ko na lang yung sarili ko. Patanggalin ko na nga yung goiter ko, ganyan. So, okay, that's so random. Tapos, class, and I reflected, natanggal pa yung parathyroid gland. I think no, kasi when I read my histopathology report, there's no parathyroid gland in the histopathology. Yan. So, and I also searched that usually surgeons do not, in thyroidectomy or thyroid resection, hindi nila tinatanggal yung parathyroid glands. Yan. Minsan, it is damaged or removed, but most of the time, it's not. So, in my histopathologic report, there's no parathyroid glands there. So, ayan. Okay. So class, hypermagnesemia and hypomagnesemia. So class, isn't it that your kidney is very important whether magnesium will be retained inside your body or it will be released in your urine. So usually class, hypermagnesemia happens when there is decreased excretion of your kidneys in cases of acute chronic failure. Yan, acute chronic failure, class. So, what else, guys? In cases of hypothyroidism, hypoaldosteronism, hypopituitarism, class, there is increased retention of your magnesiums. Yan. Class, in cases of people who are drinking antacids, yan. Mga antacids kasi may magnesium yan. Yung inimas rin may magnesium yan. So usually there is excess in intake of your magnesium. Example as well is when the intravenous fluid, so those who are hospitalized and their intravenous fluid has excess magnesium. So yan, it can result to hypermagnesemia. And in cases of hypomagnesemia, so poor diet, yan, magnesium deficient IV therapy. Sa hypermagnesemia naman, class, is excess magnesium IV therapy. Yan. Hypomagnesemia, chronic alcoholism, in cases that there is this decreased absorption in the intestine. So, kung may malabsorption syndrome, the resection of your small intestine wherein they cut a portion of your small intestine. When there is a nasogastric suction, in cases of pancreatitis, vomiting, diarrhea, laxative abuse, yan. Those who loves also drinking slimming pills, class slimming tea, no, yan. So, ang dami class actually, hypermagnesemia, cathartics, dehydration, carcinoma, metastasis, hypomagnesemia, in cases, increased excretion. So, may tatlo tayo. In the kidneys. So if there's a tubular disorder, glomerulonephritis, and pyelonephritis, inflammation of the glomerulus, and inflammation of your urinary bladder, class. So, ayun, excess output of your magnesium in the urine. So, endocrine, class. So, if there is excess parathyroid hormone, excess aldosterone, excess calcium, class. So, kasi class, every time when there is excess calcium, yan, to balance it out, sometimes magnesium is excreted in the kidneys, diabetic ketoacidosis. Yan, since there is already increased amount of cations in the circulation. So, dagdagan pa nila, bawasan na natin yung magnesium. Yan, to balance the charges in the body. And drug-induced. So, diuretics, antibiotics, cyclosporine, and digitalis. And digitalis is for the heart. So class, I just want to show you the different symptoms yan kung gaano kalala pag merong hypermagnesemia. So it can affect your heart in hypermagnesemia. It can slow down your heart beating, lethargy, coma, class. So hypotension, neuromuscular decrease, reflexes, there's arthria. We have hypomagnesemia, arrhythmia, hypertension naman, hypomagnesemia, ataxia, weakness, ganun, cramps, psychiatric rate ang hypomagnesemia, psychiatric depression, agitation, psychosis, and so on. So class, for our laboratory portion, so usually class, from our magnesium to our phosphate, we will use heparin, specifically lithium heparin. We won't use EDTA oxalates and citrates. And class, since your magnesium is an intracellular cation, so dapat no to hemolysis because there is a high magnesium in your red blood cells. Class, we have these methodologies. So Dye-Lake method. So in Dye-Lake method, we use titan yellow dye, atomic absorption, spectrophotometry. So it's our reference method. ISE class para sa electrolytes, they're so reliable. And colorimetric method. So for colorimetric method, we utilize 3 dyes. So we have calmagite, formazan dye, and methylthymol blue. So class, we also use a calcium shelter. Yan. So to prevent the interference of calcium. And class, that's it. Yan. So for calcium, guys, so mostly of our calcium class, nasa bank. Yan. So our bank for the calcium is the bones, diba? So class, in the bones, the calcium is as hydroxyapatite. Yan. So yung form ng calcium na nasa bone pa lang, class, is hydroxyapatite. 1% is in the circulation and 0.01% is inside your cells. Yan. So class, when there is excess calcium inside your cells, actually it will already promote apoptosis. So there are pumps that regulates your regulates the calcium entry inside the cells. Kasi pag nag-excess na yan, mag-apoptosis na ang cells or programmed cell death. Calcium is the most abundant metal. Yan, Ca2+. It is absorbed in your small intestine. Yan, in the duodenum. So class, dito muna tayo sa forms of calcium. So we have free or ionized calcium. So class, this free or ionized calcium, this is the one that participates in our biological processes. Itong mga free or ionized calcium, yung mga hindi complex or attached to anything. So this ionized calcium are the ones that are usually measured by the doctors in the hospital because this ionized calcium class are very important in blood coagulation, as a coenzyme, in the enzyme activity, in the contractions or neuroexcitability of your muscles, and hormone secretion. So class, once your calcium is low, it initiates the secretion of parathyroid hormone. Yan. So your calcium is very much highly regulated. So class, aside from your ionized calcium, meron tayong protein-bound calcium. So usually albumin yan naka-attach, and complex with anions. So some calciums are attached to your bicarbonate, citrate, phosphate, and lactate. So that's 15%. So class, from the bones, yan. So from the bones, so this is our bank of your calcium. But class, not only calcium, your magnesium and phosphate. Yeah, lahat yan nasa bones. So once there is decreased calcium in the circulation, now parathyroid hormone is excreted. Yan. So once there is decreased calcium in the circulation, especially ionized calcium, parathyroid hormone is secreted. Now, class, this parathyroid hormone will act upon your osteoclast. Yan, osteoclast. So class, this osteoclast are the cells in your bones which break down your bone. Yan, osteoclast. Pag osteoblast class, they are the bone cells that builds up your bone. So sila yung construction worker. So kumbaga class, this osteoclast is our demolition team. Yan. So it breaks down your bone to release calcium in the circulation. So your parathyroid hormone class activates your osteoclast, which promotes the secretion of your calcium in the circulation. So class, every time your osteoclast will break down your bone and will release calcium in the circulation. Ang tawag dyan bone resorption. Yan, bone resorption. Ibig sabihin, class, nagwi-withdraw tayo ng calcium from the bone. Yan. Actually, class, this is a normal action in the circulation. Every time, class, that there is decreased calcium in the circulation, so your osteoclast will be activated to promote bone resorption so that we have a calcium in your circulation. So, class, but in cases that there is not enough calcium in the nutrition, ayun, it can result to osteoporosis or osteopenia. Ganyan. So, basically, normal naman itong nangyayari. So, your parathyroid hormone activates your osteoclast to promote bone resorption. It will increase the reabsorption of calcium in the kidneys and will stimulate the production of vitamin D in the kidney. So class, once your parathyroid hormone is released from your parathyroid gland, class, tatlo ang gagawin niya. Okay? So number 1, it will promote bone resorption. So ang effect ng bone resorption, tataas ang calcium. Number 2, class, it will reabsorb calcium in the kidney. So, instead na may ihi ang calcium, it will reabsorb it. Yan. So, tataas na naman ng calcium. And finally, class, it will nudge or it will stimulate the kidney to produce vitamin D. Yan. So, vitamin D also promotes the increase of calcium. How? Dito na tayo. So, 1,25-dihydroxycholecalciferol or calcitriol is the active form of vitamin D that I'm talking about. So, this was synthesized by the kidney. Yan. So, initiated by the parathyroid hormone. So, once class, this vitamin D is produced sa intestine naman siya. So, aside from the kidney, it will absorb calcium in the intestine. So, you're from the diet. Get calcium from the diet, and what else? It will enhance the action of your parathyroid hormone. Yan. Kung baga, they are synergistic with your parathyroid hormone. Mag-friend sila na parathyroid hormone, ini-encourage niya na mag-resorb pa ng bone. Yan. So, yan. And finally, class, calcitonin. Yan, calcitonin. So, calcitonin does the opposite naman. So, your calcitonin class decreases your calcium. So, your calcitonin class is produced by your thyroid hormone. Yan. So, your thyroid hormone has this parafollicular C cells which produces your calcitonin. Class, na-produce ang calcitonin if there is increased calcium in the circulation. So class, this is your negative feedback. So pag mataas na yung calcium, class, so now calcitonin will take action. So now, calcitonin will inhibit your parathyroid and vitamin D. Sabi nila, guys, kalma na, mataas na ang calcium natin, and inhibits bone resorption and promotes excretion of calcium. Yan, instead of reabsorption of calcium. So, it completely does the opposite. Yan. Because, class, yan. Mamaya natin pag-usapan tong hypocalcemia. So, class, here are your hypercalcemia. So, hypercalcemia happens when there is excess parathyroid hormone in case of an adenoma. So, may tumor sa parathyroid hormone or hyperplasia. There is excess glands in your parathyroid hormone. Sa mga cancer, class, some cancer produces parathyroid hormones. Yan. In cases of acidosis, vitamin D, multiple myeloma, malignancies. Class, some cancers produces parathyroid hormone. Yan. Next, hypocalcemia. So, if there is decrease parathyroid hormone, class, ito, hypomagnesemia. Kasi, pag masyadong mababa ang magnesium, it impairs the parathyroid hormone and promotes vitamin D resistance. Suddenly, class, your body does not respond to vitamin D, and class also, hypermagnesemia as well, inhibits parathyroid hormone release. Yan. I told you, class, magnesium is antagonistic with your calcium. Vitamin D deficiency, class, so, or avitaminosis. So, if there's lack of vitamins, so hindi ma-absorb in the intestine ang calcium. Tapos, malabsorption syndrome, osteoporosis, osteomalacia. So, there's not enough calcium in the bones, and hypophosphatemia. So, class, when you have hypercalcemia, these are your symptoms. Muscle weakness, ganyan. Kasi it promotes in the excitability or the contraction of muscles. So, if there is excess calcium, so there is weakness already, there is decreased reflexes. One also is, ang tawag doon, constipation pag may hypercalcemia. And if there's hypocalcemia, we have CATs, convulsions, arrhythmia, tetany, class. So, tetany is the involuntary contraction of your muscle. So, one common cause of tetany is when there is decreased hypocalcemia, aside from Clostridium tetani toxin. Yan. Yung bacteria, diba, Clostridium tetani, yung nagpa-form ng tetany toxin. So, it can cause also tetany. Pero the common cause of tetany is hypocalcemia. Yan, spasms. So, class, most of the time, what we measure in the laboratory is your ionized calcium. Yan. So, tetany is from the fall of your ionized calcium. So, to convert your calcium, so we have multiply it by 0.25. So, for the specimen consideration, class, we do not use EDTA oxalate citrates because it chelates calcium. Yan. Lithium heparin tayo pa rin. And class, make sure that your specimen will not be exposed to air. Yan, to prevent the loss of carbon dioxide. Because when we're losing your carbon dioxide, your pH will become alkaline. And class, our methodologies for calcium, we have precipitation and redox. Titration, so we have 2 ferroham chloranilic acid precipitation method and Clark-Collep precipitation method. We have colorimetric method wherein we use the arsenazodie or orthocresophthalene complexone. Yan. Pareho lang actually to. Yan. I read it in the Bishop. And 2 class, so that magnesium will not participate in our reaction, we will use 3-hydroxyquinolone. Methodologies, we have EDTA titration method, ISE class, using liquid membrane, atomic absorption spectrophotometry for reference method. So class, that's our first part of our electrolytes.